A promise, I'm back. Good evening once again. Welcome to today's video where we are going to be looking about the tracks. If it is your very first time to watch me, please make sure you subscribe. You put on the notification bell such that whenever I load the video, you become the very first person to watch. So let's go ahead and get started and look at what we call the tracks. We need to first understand what a tract is. But simply, a tract is going to be the bundles of axons within the central nervous system. Okay, that is a simplified definition of what we call a tract, a bundle of what we call the myelinated axons within the central nervous system. Okay, so now we need to first understand where are these tracks going to be running. Okay, and of course when we talk about the tracks, they're going to be running in what we call the spinal cord. You're going to be having those kind of the tracks which are going to be moving the information from the brain down the spinal cord, and we also have such kind of the tracks which are going to be moving the information from the spinal cord up into what we call the brain. For that reason, we are going to be having two main kind of what we call the tracks. These are which are going to be carrying the information from the spinal cord up to the brain. Those are what we call ascending tracts, okay? And they are going to be carrying what we call sensory information, okay? And those kind of the tracks which are going to be carrying the information from the brain down to the spinal cord, they're going to be carrying motor response, okay? They're going to be more of motor, okay? So now we have said that those kind of tracks which are going to be taking the information from the spinal cord up to the brain, they are going to be ascending tracks. And because they are ascending tracks, they are going to be carrying what we call sensory. They are going to be carrying what we call sensory information, okay? Ascending sensory information. And these kind of the descending tracks, they're going to be carrying the motor response. So now these kind of the tracks are going to be motor, okay? They are going to be motor, okay? So now we want to see where are these kind of tracks, in which part of the white matter within the spinal cord are we going to be seeing these tracks moving, okay? So now here we have come with a cross-section of the spinal cord in one of the segment, in one of the region of the spinal cord. We want to see where do we find these kind of tracks, in which part of the white comb, or what we call the white matter, do we find this kind of the combs, okay? We have seen here, this is going to be now the whole of this red part, which is like H shape, is going to be what we call the part of our gray matter. And of course, anything aside of it is going to be part of what we call the white matter, okay? For that reason, you're going to be having this part which is going to be at the back, okay? The fact is at the back, it is at the dorsum part. We simply call it the dorsum white comb, okay? And then, of course, these one which are going to be on the lateral sides, okay? They are on the lateral sides of the gray matter. They're just simply called the lateral white columns, okay? And of course, these ones which are going to be anterior to the gray matter, they are simply called the ventral white column, or may even simply call them the anterior white columns. So now, those are the kind of the columns where we're going to be finding our tracts running up and down. But we have a specific type of the comb. We have a specific type of the white column whereby we only have the ascending tracts. And what is that? The dorsal white comb. Okay, the dorsal white column is a bit somehow unique in the way that it only allows the ascending information from the spinal cord up into what we call the brain. For that reason, in the dorsal white column, we only have ascending tracts, okay? But of course, in the lateral combs and then also the ventral combs, we have both ascending tracts and also descending tracts, okay? So now, having seen the white columns where our tracts are going to be moving up and down, let's go ahead and see which kind of those tracks are going to be moving up and then down, and where exactly are they going to be moving up and down exactly, okay? So now we are going to first make a small imaginary line and divide this cross-section of the spinal cord into both right and then the left, okay? So now in the right, you're going to be seeing where exactly do we have the ascending tracts, And of course, then in the left, we shall again locate where do we find the descending tracts. But what I want you to know is that in both sides, you're going to be having both ascending and then descending tracts. But here I have just drawn only those ascending tracts such that we don't confuse them with the descending tracts. But what I want you to know is that if I have a descending tract here in the lateral column, we have again the same descending tract in what we call the other side. Okay, so now, but we just want to first show you only on one side, but I want you to know that all those ones in this side are also going to be in the other side, with the exception of what we call the dorsal column, where we only have the ascending tracts. Okay, so now let's start with what we call the ascending tracts and where they are going to be coming from. Okay, now when we come to the dorsal column, the dorsal white column, which kind of the ascending tracts do we find there? So now when we see this kind of depressions, what we call the dorsal median sulcus. So now we have this kind of the tract which is just going to be medially to what we call the dorsal median sulcus. So now how do we call this tract here, this number one? So now this number one tract is what we call fasciculus gracilis. Is what we call fasciculus gracilis. Okay, is what we call fasciculus gracilis. Okay, that is going to be our first ascending tract. What is about number two? The one which is a bit slightly laterally to what we call fasciculus gracilis. Now, this kind of tract is what we call fasciculus cuneatus. Okay, fasciculus cuneatus. Okay, so now these are the two ascending tracts that we are going to be finding in the dorsal column. We are going to be having the ascending, the fasciculus gracilis this side. We shall also have the ascending tracts again in the other half of what we call the dorsal column. Okay, so now these kind of the ascending tracts, they are going to be carrying sensory information. But again, where are they going to be taking it? They are carrying the information from the like for example, the fasciculus gracilis, they're going to be carrying sensations of what we call fine touch. They're going to be carrying also sensation of what we call vibrations, and even also what we call proprioceptions. But exactly where are they going to be picking it from? They're going to be picking, like the fasciculus gracilis, they're going to be picking the sensation from what we call the lower extremities, okay? From lower extremities. They're going to be carrying it from the lower extremities, more especially below T6. Okay, they're going to be carrying these kind of the fine touch, vibrations, and then proprioception in the lower extremities, especially below T6. And then for the case of the fasciculus cuneatus, they're going to be carrying the proprioception, the vibrations, the fine touch in the upper extremities, okay, the upper limbs and even all other upper trunk, primarily in what we call above T6. Okay, that's going to be for the case of the ascending tracts, which are going to be residing in what we call the dorsal white column. Okay, now moving in what we call the lateral white column, we want to see which kind of the ascending tracts do we find in the lateral column. So now when you look at this kind of the ascending tract number 3, this ascending tract number 3, this one here is what we call the dorsal spinocerebellar tract. Okay, this one here is what we call the dorsal spinocerebellar tract. Okay, spinocerebellar tract. So now this is going to be now our dorsal spinocerebellar tract. So now how about number 4? You see now this kind of number 4 is what we call the lateral spinothalamic tract. Okay, this one here is what we call lateral spinothalamic tract. Is what we call lateral spinothalamic. Okay, lateral spinothalamic tract. Okay, that's going to be now our another tract which is going to be residing in what we call the lateral white column. What else? How about number 5? This number 5 is what we call ventral spinocerebellar tract. Okay, is what we call ventral spinocerebellar. Okay, spinocerebellar tract. Okay. And then also we have this kind of the tract which is number 6. Okay, this number 6. Now this number 6 is what we call spinal olivary. Okay, is what we call spinal olivary tract. Okay, spinal olivary tract. So now these kind of the tracts, they are going to be carrying sensory information. Okay, they are going to be carrying sensory information. And now, for example, for the case of the dorsal spinal cerebellar, they are going to be picking what we call the proprioception. And when we talk of the proprioception, these are going to be the sensation which are going to be picked from what we call the locomotor system, the likes of the skeletal muscles, the tendon, the ligaments, and all those structures. So now that kind of the sensation which we pick in those kind of the locomotor system is what we call proprioception. So now when we look at the dorsal spinocerebellar tract, it's going to be picking what we call proprioception, and mainly it's going to be picking it from what we call from T1 up to what we call up to L2. But you may find some other sources saying that from what we call C8 up to what we call L2. Okay, here there's going to be some little bit of the variations depending on the source of the information where you're going to be getting this kind of the information. Now when we talk of what we call the lateral spinothalamic tract, the kind of the sensation is going to be picking mainly is going to be what we call pain and temperature. Okay, it's going to be picking what we call pain. It's going to be picking what we call pain and temperature. Okay, it's going to be picking pain and temperature, and they take it into what we call the brain for the perception. Okay, and then when we talk of the ventral spinocerebellar tract, this one is going to be picking what we call proprioception also. Okay, it's also going to be picking what we call the proprioception, mainly from what we call the L2 up to what we call the COX-1. Okay, and then of course finally when we talk about the spinal olivary, this one is going to be picking sensation of what we call the proprioceptions. Okay, proprioceptions. Okay, that's generally what they are going to, the kind of this perception which is going to be, and the kind of the information which you are going to be moving up in what we call the brain. Okay, then we also have a specific type of what we call the ascending tract in the ventral white column. You see this kind of this tract here. This tract is super very important. And how do we call this kind of the tract? This kind of the tract is what we call the anterior spinothalamic. Okay, is what we call the anterior spinothalamic tract. Is what we call anterior spinothalamic. Anterior spinothalamic tract. Okay, this is one of the most very important kind of the ascending tract residing in what we call the ventral white column. And of course you're going to be having some other kind of other minor columns you're going to be residing in such kind of the area, but of course you're going to be looking at them. Now what is going to be the main role of what we call the anterior spinothalamic tract? This kind of tract is going to be picking sensations of what we call crude touch. They're going to be picking sensation of what we call the crude touch, and then pressure. Okay, what we call crude touch, and even some kind of what we call the pressure. So now those are kind of the sensations which are going to be picked by what we call the anterior spinothalamic tract. It is super very important. And of course you're going to be having some other kind of the minor ascending tracts, like for example what we call the juniocerebellar tract. You're going to be having what we call the spinotector. And of course, the spinal tectum is going to be taking the information up to what we call the tectum, mainly on what we call the superior colliculi, which is going to be part of what we call the tectum. Of course, the tectum is going to be that part within the midbrain, whereby you're going to be having that area having the four kind of the dilated structures, which we call the colliculi, the inferior colliculi up, and then the superior colliculi, which collectively form what we call the corpora quadrigemina. Okay, so now this kind of the spinal tectum is going to be taking the sensations to that area. Okay, what we call the tectum. Okay, And then those are generally, and also we may have what we call the spinal, what we call the spinal reticular. Okay, those are also going to be some of the minor kind of the ascending tracts. Okay, so now to give you a brief recap is that ascending tracts are going to be also what we call the sensory. In the dorsal white column, you're going to be having the fasciculus gracilis and then fasciculus tuminalis. And then on the lateral white column, you're going to be having the dorsal spinocerebellar tract, and then lateral spinothalamic, ventral spinocerebellar, and then spinal or livery tract. And then in the ventral white column, the main one, super very important, you're going to be seeing what we call the anterior spinothalamic that picks what we call the crude tract and even some part of what we call the proja. Okay, so now that's for the case of what we call ascending tracts. Okay.